The specialists of Advanced Gastroenterology and Surgery Associates dispel the myths about colonoscopy screening and explain that in most cases, colorectal cancer develops from precancerous polyps in the colon or rectum.
Colonoscopy screening is extremely important, and I think it's important to note that colon cancer is the second most common cause of cancer death in the country and the third most common cause of cancer in men and women. And most patients are reluctant to have the procedure performed, but it really is a preventable form of cancer, as most cancers are. Colon cancer develops from an ingrowth of the lining of the mucosa, what we call a polyp. And there are certain types of polyps, the ones that are adenomas, that can grow and eventually turn into colon cancer. It's important to note that the adenoma cancer sequence takes approximately 6 to 10 years. So every patient that we see with colon cancer, they've had a polyp growing in them for a long time, which can be prevented because when we do colonoscopies, we remove polyps. Now, of course, there's some colon cancers that may develop a little bit more rapidly, but the average time interval is 6 to 10 years. So it really is a preventable form of cancer. There's no difference between the genders. However, we start on the average risk person. We start screening at the age of 50. Now, if someone has a family history of colon cancer, then we usually start in the 40s or 10 years before the youngest age of the person affected. For instance, if someone has a family member that was diagnosed with colon cancer in their 40s, then that person should start in their 30s. A few years ago, there was a study on African American patients in this country. It was determined that the screening interval for African Americans should be from the age of 45. But there's a greater risk of colon cancer in African Americans.
For more information on colonoscopies, as well as other treatments and surgical procedures available at AGSA, please click the Colon Cancer Screening Story link on our homepage, yourhometownhealth.com.